Today we're going to go over some exercises for the condition Osgood Schlatters. They're going to help to increase the mobility in your hip and your knee, and also strengthen the muscles around the hip joint. Let's get started. For this exercise, you'll need the foam roller. We're going to be rolling the quad muscle, or the muscles on the front portion of your thigh. And this is going to help to release that tension in your quads and help to decrease the pain that you may be experiencing in the front portion of that knee. So you're going to go ahead and lay down onto the foam roller, and in this position you want to make sure your elbows are underneath your shoulders and you're keeping a nice tight core and making sure that back doesn't sag down. We're going to go through 3 different positions with our legs for this exercise. So the first would be just here with our toes pointed down. The next is going to be spreading our legs out and rotating them outward so our toes are pointing out. The third is going to be bringing our legs inward, so rotating them in, and our toes will be pointing towards one another. Making sure we're rotating the entire leg for those 3 positions. Now, during those 3 positions, this is what you're going to be doing. You're going to be rolling and scanning from above the knee all the way to right below the hips, looking for any areas that might be a little tender or uncomfortable. Now, when you find a location that's uncomfortable, you're going to stop there, and you can either hold or do small little movements up and down, trying to work that area out. Now, that tenderness may not go away completely, but once it lessens, go ahead and search the area again for another location that might be tender. Remembering, keep a good posture in this position, and you're going to go through those 3 positions where your toes are down, rotating legs outward, and rotating the legs inward. You'll complete this twice a day and do it for 2 minutes. For this exercise, we're going to do the 90-90 stretch. This is going to help increase the mobility in the hip region. So you're going to sit on the ground and you're going to put one leg out in front of you and one leg out to the side, making sure your hips, knees, and ankles are in a 90-degree angle. Now, once you're in this position, you're not going to be able to sit up completely, so you can use your hand on the ground. The goal here is to sit up without having your hand on the ground, making sure you're pushing this hip down as far as you can and keeping contact with the knees on the floor. You're going to hold here and feel that stretch throughout the hip region. So you're going to complete this 2 times a day, trying to work your way up to holding this position for 2 minutes. But at first, you may only be able to hold it for 30 seconds, and that's fine. And make sure you complete this on both sides. You also may find differences between one side and the other. One may seem really easy and the other really difficult. So keep up the good work and try to get up to that 2-minute hold. For this exercise, we're going to be strengthening the glutes, the muscles around your hip, and the hamstring muscle, the muscles on the back side of the thigh. So you're going to lay on the ground by a wall and you're going to put your feet up onto that wall, making sure your feet are a little higher than your knees. Now in this position, you're going to squeeze your glutes and raise your hips up off the ground. This is going to help activate our glute muscles, and then we're going to push our feet down towards the ground. We're not actually going to do any movement, we're just going to apply pressure through those heels towards the floor. When you do that, it activates the hamstring muscles. So you're going to hold this position, and we're trying to hold it for 30 seconds. If you can't hold it for 30 seconds, rest and then go back into the exercise. We're going to do this 2 times a day. You're going to do 2 sets trying to reach that 30-second hold. We hope these exercises were helpful for you, but if you or anyone else you know is experiencing Osgood Schlatters or any other types of pain, click the link below. We have in-office and telehealth options available. And if you'd like to see some of our other videos, click the link above. And don't forget, subscribe to our YouTube channel. See you in the next video.